Ph.D. in clinical psychology from Drexel University. She completed her pre-doctoral internship at Rush Medical Center. Since founding the Muslim Fertility Project in 2016, Dr. Elgohail has launched multiple award-winning research studies focused on psychosocial needs of Muslim women experiencing infertility. So thank you, Dr. Elgohail, for joining us. Take it away.
All right, thank you, and assalamu alaikum, everyone. So I wanted to start with a powerful quote that states that the impetus for living things to reproduce and create offspring who will survive them is so basic to life that it's one of the fundamental truths of our world, like gravity or the sun. Through it, continuity and a kind of immortality are achieved. And I think that this quote really captures the importance and the significance that is placed on the ability to reproduce. We know that motherhood is also valued in our religion. So for example, we might all be familiar with the hadith that states that Jannah is at the feet of mothers. And infertility is really something that is rarely anticipated. And when infertility and pregnancy loss occur, it's often devastating. So the research available on the infertility experiences of Muslims in the US and other Western countries is almost non-existent. And so I started the Muslim Fertility Project in 2016 to provide a platform for research in this area. And alhamdulillah, it's actually been growing into a platform beyond research, but really one that provides resources to help Muslims navigate fertility challenges and pregnancy loss. For our studies, the definition of infertility that we use is the inability to become pregnant despite regular unprotected intercourse with the same partner for a 12-month period. And this definition really includes those who are able to become pregnant but are unable to remain pregnant or carry a pregnancy to term. Primary infertility refers to women who are unable to have a first child, and secondary infertility refers to those who have at least one child but are unable to conceive or carry to term another child, and that's actually more commonly experienced. All right, so whose fault is it? Is it the woman's fault? Is it the man's fault? I think this is something that people often ask themselves. And what we find is that women are often blamed, but the reality is that infertility experiences, a third of those are male factor related, a third are female factor related, and a third are related to both male and female or unexplained. And so what this means is that a diagnosis of male factor infertility is as common as a diagnosis of female factor infertility. So in terms of prevalence, we know that the incidence of infertility is alarmingly prevalent in these 4 Western countries: Australia, Canada, the US, and the UK. And this includes over 400,000 Muslim couples each year. But again, the research available on the infertility experiences of Muslims in these countries is almost non-existent. And so we set out to change that, and I'll be presenting a small subset of data from a cross-sectional study that we conducted. And we were targeting Muslim women of reproductive age who were experiencing infertility and living in these 4 countries of interest. Now, one thing I just want to highlight here is that everyone included in the final data set was trying to conceive at the time of the study. So if they said they were, they hadn't tried in months, their provider recommended taking a break, their partner was traveling, or they're trying to adopt, whatever the reason might be, if they were no longer trying to conceive, they were not included in the final sample. So this final sample is really those who were trying to conceive at the time of the study. Recruitment took place on social media using a 3-minute video that described the study and invited viewers to spread the word or participate in the study themselves. The study ads and the recruitment video were shared via email and also were posted on the Facebook and Twitter accounts of the Muslim Fertility Project. Because of all the stigma surrounding infertility, we were so surprised that in the first week, this video was being viewed 3,000 times a day on average. And overall, it reached over 220,000 people. And in just a month, it led to the swift recruitment of almost 500 Muslim women with infertility. And that is just including the final sample. So there are others who participated in the study, but a final sample of almost 500 women. So I want to say thank you to anyone who may be listening who helped with the recruitment process or participated in this study. You really are helping make a difference. And I want to say that I really felt so supported when I launched this study by the Muslim community, because it really felt like an effort by everyone to push this study out and help get the data that we needed. So I have the video here. Let's see how I'm doing on time. I think I do have, I might actually hold off on playing the video and maybe we'll play it during the Q&A. Does that sound okay to the moderator?
I think that's a good idea.
Okay.
Assalamu alaikum. My name is
So let me. All right. So getting into the results now. So we found that there was a high prevalence of depressive symptoms in our sample. And specifically, we found that over half of the sample was experiencing clinically significant levels of depressive symptoms. And we know from the literature that depressive symptoms can often be a barrier to achieving reproductive goals. So for example, those experiencing depressive symptoms may be less likely to seek medical advice or initiate an infertility treatment. We've also seen that depressive symptoms is also associated with a premature discontinuation of infertility treatment. And so these high levels of depressive symptoms are concerning for a number of reasons, but one is also that it does create this additional barrier to achieving reproductive goals, potentially. And I cannot help but think, what would these numbers look like if we were to survey the same exact population today in the context of the pandemic? We know that now there are even more barriers to family building than there were at the time of this study. So just to highlight a couple to give you an idea, if you were to decide, yeah, I'm gonna go ahead and continue with treatment now that the fertility treatment centers are opening up again, it can feel like you are risking your life to build a family by spending time around others in these medical settings, especially if that woman or the couple already have some underlying medical conditions that put them at increased risk of developing severe symptoms if they were to contract COVID-19. For those who decide to pause because of the pandemic, that's also very stressful because time is of the essence in the context of infertility. And so thoughts around like, well, maybe this is it, maybe this means that I'm just going to run out of time and I won't be able to build a family, are definitely some thoughts that may cross the minds of those who decide, well, I'm going to pause because it's just too scary with the pandemic going on. And then beyond just conceiving, just the pregnancy process, there are also increased risks now. At the start of the pandemic, they were saying with the data, the limited data they had, that there was really no difference that they were seeing between pregnant women and others in terms of the severity of symptoms, of COVID-19 symptoms. Now that story has changed. There's recent studies that have came out suggesting that pregnant women are at higher risk of being hospitalized, of being admitted into the ICU, of being put on a ventilator. And so just lots of things to think through when it comes to family building in the time of the pandemic that we're in, that I imagine would make these depressive symptoms even higher. Now, despite the high levels of distress that we saw in our sample, only 7% engaged in mental health, and 7% of the sample engaged in mental health treatment. This is probably not surprising for those listening. This is, a finding that we find across a lot of studies looking at the Muslim population, but it is important to keep in mind for this specific population that we were looking at for this study. And what we found, however, was that every person in the sample was engaging in religious coping strategies. And in particular, we found high utilization of negative religious coping. And we found that negative religious coping, or NRC for short, was significantly and positively associated with depressive symptoms. This is consistent with what we see in the literature in terms of this relationship between negative religious coping and negative mental and physical health. I have here on the slide the items that make up the NRC subscale that is a part of a larger measure called the brief R-COPE. So you can see there are themes around feeling like this is a punishment, feeling abandoned by their community. And again, as I mentioned, this was a cross-sectional study, so we can't draw any sort of conclusions around causation, but still really good information to know about this relationship between negative religious coping and depressive symptoms. So to close, I will mention a few of the clinical implications based on the data that was shared. So we should certainly be screening for depressive symptoms and negative religious coping in this population. Generally, I really think we need to have mental health professionals embedded in fertility clinics because the distress levels that we see in the Muslim community are not unique to our community. This is very common across the board in the populations of those experiencing infertility. Negative religious coping, for those who are clinicians and who may have patients who they are treating for depressive symptoms related to their infertility experiences. Negative religious coping could potentially be a really great target in treatment. And I would expect that if it was targeted, you would see a decrease in depressive symptoms. Again, we don't really know about, a ton about the relationship between the two, but since there was this significant and positive relationship between these variables, I would expect that a decrease in NRC would lead to a decrease in depressive symptoms. And lastly, barriers to treatment could potentially be partially addressed by the integration of religion into treatment. Again, I don't think this is a surprise for this group, but good to keep in mind for this particular sample and population that we're looking at, that religion is important to them, and it is something that they are turning to cope with their fertility related challenges. And so it could be that integrating religion may help chip away at the barriers to them engaging in mental health services. So with that, I want to thank you all for your time. I have my contact information up here. I actually very recently just pulled down the Muslim Fertility Project website to revamp it. And I'm growing the MFP team, the Muslim Fertility Project team. So we're hoping to have that up and running within a few weeks, inshallah, but just threw it up here on the screen in case that's a helpful resource for people in the future.
Thank you so much, Mona. I know you all probably have lots of questions, and I hope you've been writing them down, because our hope is that we have all of our presenters first go, and then we'll go back to the Q&A section, if that's okay, just to ensure that everybody at least has the time to present. So Jazakallah for your presentation and that video. Hopefully we'll pull it back up later once we do open up that Q&A session. So can I ask if we have, so I'm gonna go to our third presenter, who is Dr. Aneesah Nadir. And so Dr. Aneesah, if you would like to pull up your information while I share your bio, that would be great. So Dr. Aneesah Nadir is a retired Arizona State University social work professor and a social worker for 40 years. Her practice, Dr. Aneesah Nadir and Associates, provides diversity training and premarital education programs. She has also combined her interest in the law and her passion for prevention to provide workshops emphasizing the proactive use of legal services. Dr. Nadir is the president and co-founder of the Islamic Social Service Association in the United States, which is a national non-for-profit headquartered in Arizona. So welcome, and thank you, Dr. Nadir, for joining us.
Thank you for having me. Can you hear me okay?
Yes.
And see the presentation okay?
Correct. If you want to put it on presenter mode, or leave it
yes.
however you would like to present.
Oh, there we go. Assalamu alaikum, bismillahirrahmanirrahim. Good morning, everyone. It's a pleasure to be here with you today. I'd like to thank the organizers of the 12th Annual Muslim Mental Health Conference. I was very honored to have had them in Arizona last year with us as we celebrated the Islamic Social Services anniversary, 20th year anniversary. And I am very honored to be here with you all today from Arizona. So I would have loved to be there with you and see you in person, but that is just the challenge. So let's see. The waiting room piece is in my view. The information about the waiting room piece is kind of in my view. Thank you so much. So my task today is to talk about some of premarital preparation as a way to address family mental health. I'm a prevention specialist, and I'm a social worker. So I've combined my passion for prevention and my focus on children, youth, and families in social work as my way of addressing some of these issues. And so I've been involved in the field of marriage preparation and marriage education now for more than 20 years. What I wanted to start out with is just taking a look at some of the problems, because marriage should be really a happy time. Getting married is a happy time. It should lead to, a happy family life. But oftentimes we see problems that also lead to mental health challenges within the family. Things like trauma, post-traumatic stress disorder, of course, domestic abuse in different forms: emotional, psychological, sexual, physical, religious, narcissistic abuse, financial abuse. All of those are some of the different aspects of domestic abuse. Child abuse, anxiety, depression. Back in the day, we used to call it nervous breakdown. And that was one of the challenges that people would face when the marriage didn't go well or marriage went wrong. Schizophrenia, substance abuse, suicide ideation or suicide, unresolved grief and loss. These issues, I actually kind of pulled those out from people that I know, either that were family members or close friends or people that I actually worked with. When their marriages didn't go well, these are some of the issues that they experience. So again, we often think of marriage as it's a happy time, and it should be, but a marriage gone wrong can cause lots of different challenges for the individuals, both the husband and the wife, and for the children. Let's see here, next slide is who does it impact? For some reason, I'm not able to advance my slides. There we go. So who's impacted? The children, the husband, the wife, the in-laws, the friends, the whole community are impacted. So when we look at a marriage gone wrong or gone bad, it's not one person, it's not just the children, it's everybody that is impacted in one way or another with regard to this. So of course, it's important for us to look at what some of the core values are of a healthy marriage. And many of us are familiar with these verses, so I won't spend much time on them, but I just wanted to remind us of the core values and of the criteria, if you will, for a healthy marriage, both emotionally and especially emotionally. So a translation of Surah Rum, Ayah 21, Allah says, and among his signs are this, that he created for you mates from among yourselves, that you may dwell in tranquility, sakina, peace. So you should have a sense of peacefulness in your marital life, okay? And he put love. Yeah, we should, a lot of people say, what's love got to do with it? Love has everything to do with it. So love, muwada, mercy, rahmah, between your hearts, verily, and that are signs for those who reflect. So these are three core values that we ought to see in a healthy, emotionally healthy marriage. And when we don't see that, then that's cause for concern. And then in Surah Baqarah, and there's other verses within the Quran and Hadith that Allah has and His Messenger provided for us. But I also chose this one that's also very familiar to us. Women are your garments, and you, men, are their garments. And I often ask in my marriage preparation course, what kind of garments are you looking for? Do you want those hard burlap kind of garments, or you like the soft and silky, or you want something kind of a little in between, but whatever that is, it should be a protection. It should be a protective covering for you. Your marriage should be you for your spouse, and your spouse for you. So just take a look at some marriage preparation stats. So we know nationally that the national divorce rate in the US is about 50%. And the last big study on the divorce rate in the Muslim community was about, in the US said about 30%, or 1 out of 3 Muslims get divorced. So I'm not as, a lot of the marriage preparation studies that I looked at how marriage preparation helps with divorce. And I have to say that I'm certainly concerned about divorce, but I'm even more concerned about people living and staying in a marriage when they're not happy. They're not happy, the children are not happy, they're not flourishing. I think that's a big concern too. So of the 70% perhaps that stay together, are they happy? Are they fulfilled? Are they living in a peaceful, loving, compassionate relationship? According to Prepare and Enrich study, premarital preparation can reduce the divorce rate by 30%, which again is what we want to see, but we also want to see that be a happy, healthy marital relationship. It was found that 79% in all marital outcomes compared to couples who did not receive premarital education. So that a 79% improvement, I'm sorry, I left out that word, a 79% improvement in all marital outcomes compared to couples who did not receive premarital education. So premarital education is a big plus. But the challenge, one of the challenges is prevention. And who wants to, most people want to focus on preventing something that's not broken yet, because we tend to be pretty short-sighted. We're more focused on the pathology and the treatment, and less focused on preventing the problems in the first place. Premarital counseling increases the likelihood a couple will seek out and use future marital and family services at first signs of mental distress. So that's really important key, because we know that there are going to be challenges throughout the marriage, and if we engage as marriage preparation or premarital, and there are a host of premarital services and marriage preparation services, if we can engage in the couple in those early on, then we can we can see them using these services throughout the marital lifespan, if you will, and inshallah, provide opportunities for a healthier marriage, because they've been to marriage counseling. They know it doesn't hurt, it's not painful, it's actually a good thing. And when they start to experience some challenges, or before they start to experience challenges, inshallah, they'll go back for some help. So what some of the students in my marriage preparation course, and I'll tell you a little bit about that, have said. So Marcy was a student in my course probably about 20 years ago, and maybe a little bit longer. So what Marcy did was, when her daughter turned 16, she sent her to my course. I think that's the biggest testimony, that for her it was meaningful. It made a difference for her, Marcy, in her marriage, and she sent her daughter to marriage preparation when she, when she turned about 16. Letitia was in my preparation course, and when she was divorced at the time. She remarried, and she brought her new husband to the course, and they took the course together. I think that's a huge testimonial. Mansour and Kamala, they were married, but they were in a new marriage, and they found that they had lots of challenges, and they were not really compatible for one another. And they worked that out in a very amiable way. And I think that said a lot. Mansour is he is such an advocate. He's out there telling brothers, you need to take marriage preparation. In fact, the sisters don't need to marry you until you've taken some marriage preparation courses. So, and especially Dr. Nadir's marriage preparation. I think that's pretty cool. And Zaida said that marriage preparation helps prevent problems, so it can help prevent problems, or it can help you recognize and get out of a toxic relationship more quickly, rather than stay in a bad marriage, because you know really what the criteria are. A lot of people are staying in bad marriages till their kids get older, so then we wonder why at 24, 25, 30 years of marriage, people are getting divorced. And sometimes it's because they were waiting for the kids, but also they don't really know, they haven't received the criteria, what will help, or the tools or the skills that they really needed to help with that. Or maybe they married somebody who really wasn't compatible for them. So what is marriage? Prevention, it's early intervention. This is not the treatment phase of services. Premarital marriage preparation education that includes workshops, seminars, starting at least as early as 14. Now, I think we can be doing some other things with younger kids in terms of helping to build sensitivity and empathy and things like that can lead into this, but in calling it marriage preparation, I think we can start at age 14 without any plans for the young person to be getting married. We're not saying you're getting married, we're just saying let's start getting some skills now, and the likelihood is that they will take it again before they get married, when they're closer to that age, and later. And then I'd say at least till age 50 or even older, that people might even engage in marriage preparation. So there are different phases of this, or different components, if you will, of marriage preparation services, including premarital coaching, premarital assessment and advisement, and of course what we're most familiar with is premarital counseling, which assists, the couple, the engaged, promised, or intended couple to, on how to address some potential issues, whether or not they are really compatible. Are there any unresolved grief and loss issues or trust issues? Are there any cross-cultural or biracial marriage issues that they need to address before the wedding ceremony? And so I think this is really important. Most couples, especially in the Muslim community, but I think at large, spend more time planning the wedding ceremony than they do the marriage. And so I think that's really a big problem. So this marriage preparation, the course that I teach, and I've been teaching this course off and on for the past 20 years, is prevention and early intervention for singles, engaged, newlywed, divorced, widowed, 14 to 50 years old on average. It's for girls and for guys, for men and for women. This is not something that the women just need to take, although my son even said that the women ought to demand it, you know, and the families of the women ought to demand it, you know, before marriage, that the men also take it. Because I think, as I said, people are less likely to take it because why bother? You know, there's nothing broken. What makes you think let's not call on problems? Let's not call on the evil eye, right? Most go into marriage without knowing what it means, even and takes what it means and what it takes to have a healthy marriage. And most don't even know themselves. Most people are going into marriage without even knowing themselves and knowing what they're looking for. So, and these days, most people marry someone they don't know. It's not like, you know, maybe when we were younger and we married, and people married the boy or the girl next door, or the boy or the girl in the village, people that you grew up with, you know, played, you know, kickball with on the block or something like that. We don't do that. And so today what we're looking at is marriage is like a box of chocolate. You never know what you're going to get. And if you don't prepare for that, and if you don't take some time to really get those skills in, marriage can even be a crapshoot. So the marriage preparation, there are different marriage preparation services within the Muslim community. We don't have a requirement like the Catholic community has, and which is a shame, I think. But there are different reasons that I have heard from the imams and some of the community leaders about that. But so it can range from something as short as a few minutes to an hour with an imam, maybe. Family and Youth Institute has a 6-session program. My course is actually 12 sessions. And I started out, you know, with you know, at least 3, then 6. And then I realized this is the most important job, or one of the most important jobs we're ever going to have. You know, if you get married, it's going to be huge in your life and in your family's life. And so 12 sessions at least, with 2 hours each. So you see Dr. Nadir's Before the Nikah Marriage Preparation course, 12-week course, 2 hours per week via Zoom and in person. We were already pivoting pre-COVID. So I'm a classroom teacher. I like the synergy of being in classroom, but we've learned how to make it more available by using the Zoom platform as well. It includes homework, reading, activity sheets, role plays, discussion. I have guest teachers that come in. The strategy basically is about engaging in real talk before marriage. It's not just about, you know, what marriage in Islam, but that's huge because that's a huge part of it. But it's not just the fiqh of marriage is what I'm saying. It's about the reality of marriage. What does it take to really get to know yourself? What does it take to get to know? And I put that in caps because know is a big, big term that we often, you know, like he's a good brother or she's a nice sister, but they don't really know. And then before we know it, they're married and then they have problems. And the addition of that is the serious vetting process. So we talk about that. You know, what does it take to really vet this person to find out if this is the good person and compatible for you? And how do we recognize potential abuse or narcissistic abuse and the red flags? And even we talk about the legal considerations, both civil and Islamic, and how though both in the U.S. and Canada. So those are very important considerations. And what are the expectations? Have most people get married and they have unrealistic or unexpressed expectations? And even what are the dreams for our family? So, and these are some of the different topics that we also cover, in addition to some of that, laying that foundation of getting to know yourself and getting to know what you're looking for in a spouse and how to get to know that person. So know and informed consent are big pieces of what we do. But in addition to that, we focus on some of these other really important topics, and we have guest speakers and guest presenters and guest faculty really to come in and spend some time with my students on these particular topics. So this is the flyer for the Dr. Aneesah Nadir's Before the Nikah Marriage Preparation course. I invite you to take a look at it. The registration information is there at the top of the page, and the next class starts September 14. And that's my contact information. In closing, I want to say that if we can help people identify what makes a healthy marriage and obtain some of the skills that are needed prior to marriage, and then assist them, or even in the beginning newlywed phases when they're most apt to be open to learning some things about what it means to be married. I think that we can prevent some of the mental health challenges that we see when marriages have gone wrong. So thank you for the time that we had together, and inshallah, I look forward to addressing some of the questions or comments that you may have. Thank you.
Jazakallah. Thank you so much, Dr. Nadir. That was very enlightening information to share. And inshallah, folks would be able to ask you some questions after our last presenter presents his work.
Inshallah.
Inshallah. Jazakallah.
Wa
And so we're moving swiftly along here. We have our third presenter is joining us. And I'm sorry if I butcher your name. Do you mind saying your name so I don't say it incorrectly?
You mean Medaim? My name is Medaim.
Medaim?
Yes.
And
yes.
Yanik?
Medaim Yanik, yes.
Yanik. Okay, we have Dr. Medaim Yanik, who will share his presentation entitled A Community Educational Model of Engendering Psychological and Familial Well-Being Within the Muslim Community. Dr. Yanik began his medical education at Istanbul Medical Facility in 1987. He completed his psychiatry residency at Pasa Medical Facility in 2000. Between the years of 2009 and 2015, he was a founding academic member of the psychology department of Istanbul Seher University. Currently, he's the head of the Department of Psychology of Ibn Haldun University. He has over 45 articles published, 25 that have been published in international journals, and 21 articles that have published in national journals. So thank you for joining us, Doctor, and we look forward to hearing your presentation.
Okay, thank you. Thank you very much. May I share my screen?
Yes, please do.
Okay. Today, I'm going to offer a community educational model for enhancing psychological and familial well-being in the Muslim community. And the first, I think we have, as a mental health professional, we have two tendencies. One of them, we have tendency to see our patient or clients at the hospital or at our office where we work. We think that our main job place is hospital or our office. And I think our second tendency is focusing on the treatment, not the prevention. Whereas staying at the hospital and focusing on the treatment does not provide enough well-being. We should also go into community and with the goal of prevention, not just treatment. As far as I know, there are two different models of mental health system. One of them hospital or office-based services, and second one is a community-based services. If you compare two systems at the hospital-based services, usually mental health professionals stay their clinic, and the patient or client come to directly the psychologist or psychiatrist to help. And the main focus is treatment and treatment intervention. If you look at the community-based services, usually professionals go to community and see cases in real life. Seeing the person in real life is I think is a really different issue. And the community-based services give an opportunity, provide both prevention and treatment also, and also give a chance to make a educational program. I think that the first habit we need to develop for community well-being is to go to community, not stay on the office or our clinic. We should go to community. And another issue is usually, you know, our tendency to focus on the treatment. I think it's also a problem because, you know, we are treatment efforts usually after some disease or problem. For example, you know, the people has some childhood trauma and develop some psychological disorder, we can try to treat them. But I know that most childhood traumas actually can be prevented. I'm seeing 7 clients every day. 3 of them is like a person who has childhood trauma, because I'm the one of the specialists working in person who has childhood trauma. And you know, it's okay, we can treat this people who has childhood trauma, but it is not easy. I think if we have a chance to prevent the childhood trauma, it will more helpful for the people. Also, well, one of my other specialty area is couple therapies. Almost I'm seeing 3 couples every day. Okay, we know that some couple therapies may help to some marriages. It's a moderate effect. But I think most marriages can be improved with the enhancement program, marriage enrichment program. I think that the second habit we need to develop for the community well-being is to develop preventative effort, not only treatment effort. Is another issue. If you look at the education activity, mostly based on lecture or seminars. But if you look at the only lecture and seminars, mostly is giving information, more theoretical, and only speaker active and the participant usually passive. And then there is no chance for customization. And usually only wife, husband, and teenager attend. If you look at the workshop is provide both information and the skills. It's a more practical, more interactive, and we can customize the information and the skill for the person or family. And usually couples family attend. You know, if you give I know in Turkey, if you want to give a seminar about the marriage, maybe you can find 100 women to some you know, the place they can gather some place to listen you. But if they come to only themselves, I think I'm not sure we are giving help to them, because the main thing, couples should come together. Family attending is the main things. That means third habit we need to develop for community well-being is to turn educational activities into workshop. Like we should give up to habit only, you know, the lecture or seminars. If we look at, please, the activity about the family or other community issue, maybe more than 70% is lecture or seminars. I think this is the big mistake. But as far as my experience, the community program is not easy one. It's actually it's not usually always successful. In fact, most of them are unsuccessful. I think at least 5 necessity for success of necessity for success of the program. Recognize popular individual like a celebrity that people that, should know him or her, or trusted organization are needed for the program to be accepted by the community. Otherwise, if even you are trying the best things, the good things, people not attending this kind of program in my experience. Also, it is not the easy process. You know, usually this kind of program is doing like a, you know, 1 times in a year, because they are not continuing at regular intervals several years because funding is not enough. There is no organization behind of this kind of program. Also, another problem, sometimes the program is not integrated Islamically, and it makes difficult to accept from the community. And also, we are doing something, but it's not the, you know, we couldn't measure the effectiveness of the program. I think at least 5 essential programs necessary for the community. First one is marital enhancement program, marital enrichment program, premarital compatibility program, parental education, psychospiritual well-being program for youth, and anger management. You know, previous speaker also mentioned about the divorce rate also high in the Muslim community, not on the United States. Also, in Turkey, our number rates also continuously increasing. And I think marital enhancement, and we don't have marital enhancement program for Turkey. Actually, I will mention about, I developed someone, but if some program is taking like a continuing several years, if don't continue several years, I'm not saying this is the program. And also, premarital compatibility is also important problem, because increasing the quality of marriage decision and marrying someone with a profile that is suitable for his positively affect course of marriage. And now I will say something about which I'm trying to develop. I call it School of Mind. I have been working this project last 5 years, and this is the education platforms, the School of Mind, based on psychology and psychiatry, which aims to support the well-being of the individual and families in the community. Actually, we have more than 16 programs, but the 5 program is important, previously I mentioned. And all programs of the School of Mind have offline, online, and a face-to-face version. Our first program, we call it Happy Marriage program. You are seeing on the left, this is my book. We call it 7 Quality of Happy Marriages. And the second one, the left-hand side, is a workbook of this workshop. And the third one, look at the science, spirituality of marriage, nurturing love and compassion. We did it Khalil Center. My program translated to English and added something from Human Keshavarzi and other people. And actually, we did this program in Chicago 1 time. And until now, my program, I made it like more than 7 times in Turkey. I'm trying to continue, make it continuously, but it is it's not easy job. This program is like a 7 hours workshop program. Now we have a offline version of it. One quality is one part of the workshop is they have a positive outlook towards their marriage, and another. Second quality, they accepted their differences. We are focused on the differences. And the third quality, their fights do not take a destructive form. We are focusing on fighting process, on how to make a deal. Fourth quality, their resentment does not last for long. And five quality, they protect and maintain their sexual lives. Six quality, they are able to manage their challenges of the shared life. And the seven quality, they are good friends. And the second program, we call it Before Saying Yes. This is the actually compatibility program. As like a before the decision making, before saying yes. This is a focusing decision making process of marriage, and it's about choosing the right I'm not saying the right person, but I'm saying the right profile partner. You know, it's also the left hand side. I have a book about this, and also there is a workbook in this program. We are focused on self-awareness, get to know the partner, evaluate compatibility, the advantages and disadvantages of matching methods for oneself, understanding the optimal time to match with someone, be aware of their own decision-making process. Another program we have developed, parenting skill training. Look at the left-hand side. I have a book about this. And this program is actually coming from my DID work. I have more than 30 different files with dissociative identity disorder patient. And we look at the all file and collect the traumatic life event. And we classify 58 different teams. And also we made another research with the 750 people without mental health problems. We asked them, do you have any positive memory of your childhood? Please tell us. Then we get both of them together. One part of the about the traumatic life event, and another one is a positive life event in your childhood. Then this program to try to teach the parents this kind of behavior is traumatic. This kind of behavior is actually helping your children. And the other program we have developed is a spiritual well-being program for the youth. Actually, there are 8 different parts of this to understand the meaning of existence, developing intellectual mind, to improve moral and virtuous behavior, to build social connection, improve skills, to establish academic and professional career, education in the body and maintaining health, and find your partner and maintaining a family life. This is also like a 7 hours workshop. And another one is about the anger management program. Actually, the left-hand side, right side, you are seeing the workbook of this workshop. And there are main 4 chapters on this program. First one is learning the distinction between normal anger and outburst. The second one, determining the type of anger by distinguish between different types of anger. I say there are 3 types of anger. And also we are working on 5-step anger model, which I developed working with my client. And also the last part is learning the ability, recording and monitoring the anger. At the end, my conclusion, my proposal is that if we want to develop a sense of resilience and psychological empowerment in Muslim community, mental health professionals must focus on increasing both preventative education and practical skill development. I think the model of the School of Mind can serve as an example that can be generalized and implemented in other Muslim communities. I think this kind of program, developing this kind of program at this 5 area, and giving to community is as a duty for mental health professional as a Muslim. And this is my end of my speaking. Thank you for listening to me.
Thank you so much, Dr. Yanik, and thank you to all of our presenters with your insightful and inspiring research and work that you have done within the communities. Jazakallah. So the time is right now 10:33. We were going to extend our time into 10:45 for questions and answers. And so if folks either want to A, type in their question on the group chat, or B, if you go into participants, you're able to raise your hand if you wanted to ask your question verbally to our presenters. So we'll take a few questions, and I'm sorry if we don't get to everyone's questions, but please do contact the presenter of your choice should you have further questions, and reach out to them and ask them. So let's open it up for questions should you all have any. You may go to the participant, and you may participant on the bottom pane, and you may raise your hand if you have a question, or you could type it in as well. As we're waiting for questions, I know Dr. Elgohail wanted to share her video. So if we wanted just to hear that video to see that recruitment, that would be great. And then we could do Farah Shaheen's question as well. So are you able, Dr. Elgohail, to see the questions also on the chat box?
Yeah, I can see them.
Okay.
Let me, so should I see one question for me there.
Yeah.
I might share the video and then do questions. Is that okay?
Yes.
All right, let me try to reshare my screen here. I will say while I'm pulling this up that it is still uncomfortable for me to see myself on screen in a video. But for those who have had challenges recruiting individuals from the Muslim community for their research, I feel you. It is hard, and so I hope that seeing this might maybe get your thoughts running about some ways to maybe try some new recruitment strategies. All right, can you see my screen?
Yes.
Yeah.
All right, I'm gonna go ahead and play. Let me know if you can't hear the audio. Hopefully it'll work fine.
Assalamu alaikum. My name is Muna Elgohail, and I'm a clinical psychology Ph.D. student and researcher at Drexel University. My clinical and research interests are in women's reproductive health issues, and I'm especially interested in improving the mental health of our Muslim communities. About 12% of women in America of reproductive age struggle with getting pregnant or carrying a pregnancy to live birth. This also includes women who are experiencing difficulty having a second child. And we see similar numbers in Canada, the UK, and Australia. Unsurprisingly, studies have found that infertility is a deeply distressing experience. In one study, 50% of women regarded infertility as the most upsetting event of their lives. Studies also show that infertility is associated with high levels of depression, and that depression may adversely affect the success rates of infertility treatments. In other words, infertility may lead to stress or depression, which may make having a baby even more difficult. So this is where my study comes in. With the growing number of Muslim populations in the West, we can safely assume that over 250,000 Muslim women are struggling with infertility in the US, Canada, the UK, and Australia. But what's sad is that our community does not have well-established support groups or faith-based counseling practices for these sisters. While there have been studies done on Christian and Jewish women and the role that faith plays in their struggle with infertility, no such study has been done on Muslim women in the West. So I recently launched the Muslim Fertility Project. The first step is a survey to gather data. I'm looking for at least 200 Muslim women who are struggling with infertility to take the survey. My hope is that the survey's results will help us achieve two goals. Number one, establish an effective faith-based therapy that caters to Muslim women. Number two, build a national support group for Muslim women struggling with infertility. So I'm asking for your help. First, you can spread the word by sharing this video. I can also send you an email that you can forward to your friends. Second, help me recruit 200 Muslim women to take this survey. You can find the link here. And third, like the Muslim Fertility Project on Facebook and follow us on Twitter, where you can find updates and also find out how to get involved as a volunteer. The Prophet Muhammad, peace be upon him, said that whoever helps relieve a fellow believer of a distress, that God will relieve him or her of a distress on the day of judgment. And he also said, God helps a servant as long as he or she is helping others. By taking the survey or helping spread the word, I pray that we can all be counted amongst those who are helping others. Thank you for your time. Assalamu alaikum.
Thank you for sharing that video as a means to see how you recruited. That was excellent. And then if we could just go to the question that Farah posed for you, and then we'll go on to other questions as well.
Yes. I just have to find it here.
She asked, what can we do as a society to reduce the stigma towards women when there is a concern for infertility? I can only speak generally for Pakistani culture. How strong the hurt and the stigma is for women?
Yeah, I think the first step is just having more conversations about it. I think the lack of discussions around infertility, fertility challenges, miscarriages, different types of pregnancy loss is problematic, especially given how common these experiences are. And so I think the more that we talk about it, and it doesn't mean you have to, you know, I'm not saying that everyone who experiences this has to share it with the world, but certainly as professionals, as mental health professionals, we should bring these issues to light and start these conversations in our communities. And I think that will make a huge difference. I can share that when I started the Muslim Fertility Project, I found a lot of people commenting in Facebook about how healing it is just to see, you know, on screen a community of people who are getting together around this issue. And so my recommendation is to start conversations around this topic.
Thank you, Jazakallah, for your response. The next question comes from Ahmed, and this is for Dr. Yanik, asking you if you have any papers on this work and if you could please share them, and whether your programs are grounded specifically in Islam.
Actually, my program is, you know, the Turkey is, everyone say we are Muslim, and my all content is, you know, I'm looking to always Islam. I'm always be careful for the Islamic knowledge, but the experience we translated my program to English, and the Human Keshavarzi actually added 20% of the directly some knowledge about the, the Muslim perspective. Actually, most of my content is carefully checked with the Islamic view, but some of them is the directly mentioning about Islam. But as I think, if we translate it, we are working with the Human now. Maybe we translated the other program to for United States, and we will work all of the program, and also to develop Islamically integrated approach for this program. Maybe in US is that different, because the Muslim community, I'm trying to service all of the community in Turkey, but in the United States, maybe the program is usually focused on the Muslim community, because of this reason, it should be some changes. I can say that.
Jazakallah for your response. I know it is 10:43 and others have other presentations to go to, so I'm going to just ask one more question from what we have here. And this is something from WOVA that was shared by Zarina or others that posted there. And this is for Dr. Nadir, just so everybody at least gets one question. And so the question is, what should we, realistically speaking, teach Muslim girls and boys about their right to agency, respect, honor, and dignity from their spouse? Culturally, it seems it's a right we give husbands but not wives, which makes many women feel they must lose their voice and their agency to make their marriage work. So again, it's 10:43, so if you could respond, that would be great, and then we could wrap it up.
Assalamu alaikum. I think that this is such an important thing. Marriage takes both, the husband and the wife, and we need to be able to start young. And so I agree with Dr. Yanik. Prevention is really key, and I'm talking about prevention as early as we can. We may not do the marriage preparation course that early, but we teach young people, little kids, to respect women, to respect each other, that boys aren't better than women, that girls have a lot to contribute, that you should listen to the things that a girl says. And then as parents, even more importantly, as parents, we need to role model it. Part of the challenge is that the parents have not been role modeling good and healthy marriages for their children. And so we're growing up this next generation of young people. I've got grandchildren who are 5 and 3 and 4 years old. So my job now, and their parents' job, is to help them as they're growing up gain these skills, help recognize the value of one another, and have empathy in their hearts for each other, that we're brothers and sisters in Islam, and before you get married, and then when you marry, we're brothers and sisters in Islam. And also the words of the Prophet ﷺ, that women, as women have rights over you, and you have rights over them, so it's not like you're better than them. So I think that's going to be an important lesson, but it's going to have to start young. It's going to have to start early, and it's going to have to start now.
Jazakallah, and you wrapped that up so concisely in like a minute and a half. And I know you all have so much more knowledge and information to share with us, but unfortunately our time is up. So Jazakallah to all of our presenters for your wealth of information and knowledge that you shared with us today. And all of the participants, I'm sorry we did not get to all of your questions, but please do reach out to, again, each of the respective presenters to share with them your questions. And I'm sure they still are able to see your questions posted in the WOVA app. And so if the presenters want to go back and look which questions are directed to them, that would be wonderful. Jazakallah for everyone today for participating. We're sorry about the technical issues, and we appreciate this wealth of knowledge shared in our learning community. Jazakallah.
Thank you.
Thank you.